And that's basically the Wilson's test. So now I'm doing the measurement of the tibio-femoral angle. This is usually access geni valgum and varus. Positive result is geni valgum greater than 11 degrees and geni varus general less than 4 degrees. I want my stationary arm between the midpoint of the ISAS and the greatest aspect of the greater trochanter. I want my movable arm aligned between the lateral and medial malleolus. And my stationary, my axis is on the center of the knee. Get my axis on the center of the knee. I'm going to line my moving arm up between the medial and lateral malleolus. I want to get my stationary arm between the ASIS and greater trochanter. And the goniometer tells me she has about 10 degrees. So that would put her at 10 degrees. Go to the other side. I want to get my axis on the center. Line up my stationary arm between the ASIS and greater trochanter. And my moving arm in the middle of the medial and lateral malleolus. And this side also says she has about 10 degrees of tibio-femoral angle. So now we're doing the measurement of the quadriceps angle, also known as the Q angle. It's usually excessive angulation of quadriceps muscle relative to the patellar tendon. A positive result is angles less than 10 degrees and greater than 18 degrees of abnormal can contribute to patellofemoral pain syndrome. So what I want to do is line the axis of the goniometer with the midpoint of the patella. I'm going to line the stationary arm up with the anterior superior iliac spine. And I'm going to line the movable arm with the tibial tuberosity. So I want to get the stationary on the midpoint of the patella right here. Line the immovable arm up with the ASIS. I palpate for it. Find it up in there. So going to line it up. Get it on the 0. Now I want to line this moving arm up with her tibial tuberosity. So I palpate it and I feel it right here at the knot. And just going to line this movable arm up with the tibial tuberosity. I did, and they gave me about 15 degrees, so they put her in the normal range on this side. I'll go to the other side, line the stationary arm up with her ASIS. I'm going to line the fulcrum up with her midpoint of her patella. Line the movable arm up with her tibial tuberosity. So going to line the stationary arm up and the fulcrum up. Going to palpate with her tibial tuberosity. See if I can. On this side, it tells me that she also has about 15 degrees of Q angle. So now I'm doing the measurement of genu recurvature. That's just excessive knee hyperextension. It's usually excessive genu recurvature or knee hyperextension, like I said. The positive result is greater than 0 in males and greater than 5 in females of hyperextension when the knee is fully extended. So what I want to do is line my fulcrum up over her lateral joint line. Find the lateral joint line up in there. I want to line the stationary arm up with her greater trochanter and line the movable arm up by her lateral malleolus. So I go in and find the greater trochanter, and I go in and find the lateral joint line and get that lined up first. A greater trochanter. And then I want to line it up with her lateral malleolus, that movable line. And the goni, dang, I gotta redo it. Line it up again. I need the lateral joint line. Line it up with the greater trochanter. line with the lateral malleolus. The goniometer told me that she has about 2 degrees of the GNU curvature. Go to the other side and do it bilaterally. So now I'm measuring GNU curvature on the other side. Line the fulcrum up with her lateral joint line. Line the stationary arm up with her greater trochanterus. Palpate and find that. I'm gonna line the movable arm up with her lateral malleolus. Over here it says she also has about 2 degrees of GNU curvature. So now we're doing the measurement of tibial torsion. This is used to measure excessive torsion of the tibia. Positive result is medial torsion less than 10 degrees, pigeon toe, lateral torsion more than 30 degrees, excessive toe out. So, going and get my goniometer lined up. Get that foot straight up. This tells me she has about 15 degrees of tibial torsion. I guess that would put her, it would put her either into the pigeon toe or excessive toe out range. So I guess she's in between. Do the same thing on this side bilaterally. Over here it also tells me she has about 15 degrees of tibial torsion. And that will put her in that mid range, not in the excessive toe out or pigeon toe category.